Hello, and welcome to my webinar, Review of CDC Infection Control Guidelines in the Dental Healthcare Setting. My name is Dr. Marie Fluent, and I would like to welcome you all and thank you for joining me this evening for this presentation. Before I begin, I would like to first express my thoughts and prayers to those affected by Hurricane Harvey and Irma. I'm hoping and praying for safety enduring this storm and for recovery. I also have a couple housekeeping morsels for you. I will speak for 45 minutes to 50 minutes today. I will have about 10 to 15 minutes of opportunity for Q&A. You can type in questions to me at the end of the presentation or during, and we will chat for about 10 minutes doing Q&A. At the end of the presentation, you will be directed to a quiz. The quiz is 5 questions in multiple choice format, and the quiz, it should be pretty easy. I'll stress the areas that will be assessed during the presentation. So with that, let us begin. The format of this presentation is a little bit unusual. It is a text conversation. I came up with this idea because, number one, we're all familiar with texting these days, but also I like the simplicity and the condensed form and the plain language of texting. So I thought we would text back and forth during this presentation. So up the upper toolbar area, you'll see MTF, and those are my initials, and then ICC stands for the Infection Control Coordinator. And any of you in the audience might be the Infection Control Coordinator, so you would be on the blue side and I'll be on the gray side, and we'll just go back and forth for the duration of this presentation. Now, I do have some disclosures to share with you. First, I am an educational consultant with OSAP. OSAP is the Organization for Safety, Asepsis, and Prevention. OSAP is our one and only infection control organization dedicated exclusively to dentistry. And if you're not a member, I would highly encourage you to investigate this, and I'll share more about it at the end of the presentation. This presentation is being sponsored by Air Techniques, and I want to thank my friends at Air Techniques for providing this opportunity to me. So here are our course objectives today. We're going to talk about the principal CDC documents that pertain to us in dentistry. The first is the CDC Guidelines for Infection Control in Dental Healthcare Settings that was published in 2003, and the newest publication that was published in 2016, the Summary of Infection Prevention Practices in Dental Settings, Basic Expectations for Safe Care. We'll talk a little bit about both. We'll talk about the elements of standard precautions and the stress that they do indeed work. And we'll also talk about what's new since the 2003 document was published by the CDC. Are there any new recommendations, and what do we need to know? So first, let's talk about the CDC and what they do and what they don't do. CDC, its purpose is, first of all, it's called the Centers for Disease Control and Prevention, and the purpose is to increase health security of our country, both in the United States and abroad. CDC fights diseases and supports communities to do the same, and this can include chronic or acute diseases, curable or preventable diseases, and even things such as keeping us safe after hurricanes. They also address school immunizations, health considerations for travel, and anything else we need to keep us safe. It's a public health agency, and it is developed by advisory members, ad hoc groups, CDC staff, and some of the rationale published by the CDC is based on rationale from systematic reviews and expert opinions. Now, you might want to say, boy, is the CDC the same as OSHA? No, it is not. OSHA is a regulatory agency. A regulatory agency has the ability or the authority to come in and inspect your office, potentially impose fines, and even the abilities to shut down a practice if they deem it's necessary or in the best health of everybody. OSHA is a regulatory agency. CDC is not. CDC is an advisory agency. However, state boards and other regulatory agencies base their policies and protocol upon CDC guidelines and turn them into regulations. So we do need to be familiar with both OSHA regulations and CDC guidelines. Now we also need to know that OSHA is most concerned, OSHA stands for, by the way, Occupational Safety and Health Administration. OSHA is most concerned with the safety of employees. As a result, they mandate that employers evaluate working conditions, provide a safe working environment, provide safeguards against exposure to various illnesses and viruses. OSHA wants employers to evaluate the risks of specific tasks that are performed on the job, and OSHA mandates the OSHA bloodborne pathogen standard be available to all employees. OSHA also mandates that employees are offered initial and annual infection control training, and the training should occur on at least a yearly basis, and any time standards should change or your specific tasks that you perform in the office should change or your risk should increase due to various situations, OSHA would want you to go back and be retrained in those areas. Now let's talk about these CDC guidelines. The CDC guidelines have two major components. First is the background, scientific rationale, and principles, and the second section is the section for the actual recommendations themselves. Now, when possible, these recommendations rely on evidence-based studies. When I first began my study into infection control, I was kind of surprised by that. I thought everything we do in science and medicine must be evidence-based. However, there are ethical or logistical reasons why these recommendations cannot be based on a scientific study. And it would be unethical to reuse a needle several times to see what would happen for the purpose of science, or not wash our hands, or not wipe down environmental surfaces. Obviously, those would be unethical studies, and so as a result, these recommendations may be based on strong theoretical rationale, suggestive evidence, committee reports, or opinions of respected authorities based on clinical experience. So let's back way up. Why is this infection control stuff even important? Well, diseases can be transmitted in the dental setting, and fortunately, disease transmission in dentistry is very, very rare. And I will go ahead and show you on the next slide. This is how the CDC illustrates transmissions that may occur in dentistry. You'll notice there's 3 arrows. The first is a very large one, second is medium sized, and the smallest is the third. So the largest arrow indicates that diseases are most likely to be transmitted from patient to dental worker. This is because we are the ones who handle contaminated instruments, sharp tip scalers, syringes, etc. So we are at a higher risk of infection transmission than our patients. Notice that other transmissions can occur, dental worker to patient or patient to patient, but these are less likely. We are at a greater risk than our patients. This leads us to something called the chain of infection, and these are the steps that must occur for an infection to occur. So let's go to the next slide and look at this chain of transmission. In the chain of transmission, we have links, and you can see from my PowerPointing skills, they should be all linked together. They may appear not to be, but they are. So let's start at the top. First, we have an infectious agent. Let's pretend that a patient enters my office and he or she has the flu. He comes in coughing or hacking, and he's infected with a flu virus. That's our infectious agent. The reservoir is where this disease agent normally lives, grows, and multiplies, and that would be the respiratory tract of my patient. Then we have a portal of exit, and our patient happens to be coughing, hacking, and sneezing, and that is how the virus exits his body. And we have the mode of transmission, and I have inhaled some of these viral particles. The portal of entry is my respiratory tract, and lo and behold, if I have not received my influenza vaccination, I am a susceptible host, and I am indeed infected. This is called the chain of infection. And what our goal is to try to break these links as much and as often as possible to prevent infections from transmitting. Okay, so let's go and talk about bloodborne pathogens, because that's kind of what we're concerned about in dentistry. We know about the bloodborne pathogen standard. We've all heard about hepatitis B, hepatitis C, and HIV. So let's show you how many bloodborne pathogen illnesses have been transmitted from 2003 up to 2015. This is a chart adapted from an article I read recently by Dr. Jennifer Cleveland. I have great respect from her. She recently She recently retired from CDC, and she and some colleagues wrote an article entitled Transmission of Bloodborne Pathogens in the U.S. Healthcare Settings, and it was published September 2016. And this is adapted from her article. So you can see since 2003 there haven't been too many. We have one hepatitis B case that was transmitted in an oral surgeon's practice, 5 that were in a free dental clinic in a high school gymnasium, and that would be like a mission dentistry program. And third, we have an oral surgeon's practice that was responsible for transmitting the first case ever of hepatitis C in a dental healthcare setting in the U.S. And it's believed that these are primarily due to unsafe injection practices, failure to heat sterilize dental handpieces between patients, and failure to monitor or spore test. And these reports they highlight the need for comprehensive training to improve understanding of underlying principles, practices, their implementation, and conditions that have to be met for disease transmission. So, as a result of this, CDC published a new document called Summary of Infection Prevention Practices in Dental Healthcare Settings, Basic Expectations for Care. This came out, as I mentioned, in 2016. It's based on the 2003 guidelines, and it represents the basic infection prevention expectations. What I like about this document is that it is written in plain language, so it's easy to understand. You're not going to be bogged down in scientific jargon. This document is not a replacement for the full guidelines, and we have to remember that. I compare it to a CliffsNotes version or a SparksNotes version, something that is like a condensed version of the principal document. So remember that it's not intended to replace the full or extensive guidelines, and readers are encouraged to consult the full guidelines for source documents, additional background, rationale, scientific evidence, etc. So what else is in the summary? First of all, it reaffirms that standard precautions are the foundation for infection prevention. It highlights the existing CDC recommendations, and it also includes fundamental elements needed to prevent disease transmission in dental settings, a 2-part checklist, and reference. And that is a lot of information, and we're going to take these sections little by little. So let's talk about standard precautions first. Standard precautions are the minimum infection prevention practices that apply to all patient care, regardless of suspected or confirmed infectious status of the patient in any healthcare setting. They're designed to prevent dental personnel and prevent the spread of infections among patients. And yes, I did read that, but that's an important statement, and I encourage you all to remember that because it may appear on a quiz you're about to see in about 50 minutes. So I have but what if, and I want to share a little anecdotal story with you that happened to me in private practice. I had a patient come in who checked yes, he was indeed a hepatitis B carrier. And we thought we were applying standard precautions during patient care, and yes, we were. But after patient care, I peeked my head in the sterilization room, and I saw my dental assistant processing the instruments in a manner that was completely unfamiliar to me. What she did was she took the instruments, bagged them first, and then put them through the autoclave. Then she was going to unwrap them. Then she was going to put them in the ultrasonic to clean them. Then she was going to dry them, inspect them, and rewrap them and re-sterilize them. And I said, oh, what's happening in here? And she said, well, this patient you see is a hepatitis B carrier, so I thought I would X, Y, and Z. And I said, no, that's not standard precautions. And she said, yes, but I get the standard precaution thing, but this time we know he admitted it, so he is more infective and we should take every precaution. And I said, no, we have patients who come through these doors who also may be hepatitis B carriers, and we would never know. And she said, but this time we know. And I repeated over and over again, standard precautions, they work. They apply to all patients, each and every appointment. We treat all patients, every appointment, exactly the same. And we went back and forth, and finally she said, okay, I get it. I get it. So standard precautions apply to all patients, every appointment. So let me show you some examples. This is a herpes simplex infection. A patient had a herpetic infection on his lip, and this is back from the days of wet-handed dentistry. The infection you see on the finger is something called a herpetic whitlow from touching a contaminated lip, and lo and behold, a scratch of the eye and the herpetic infection can be spread there too. So how do you prevent this? Standard precautions. Glove up, wear proper PPE, wear your eyewear. We're going to go through the elements of standard precautions in just a moment, but standard precautions work. Here are the elements of standard precautions, and we know most of these. Hand hygiene, the use of PPE, respiratory hygiene and cough etiquette, sharp safety, using engineering and work practice control, safe injection practices, that would include aseptic technique for parenteral medications, sterile instruments and devices, cleaning and disinfection of environmental surfaces. And there are, of these standard precautions, you'll see a couple of them are new. Safe injection practices is new, and that would be the aseptic technique for parenteral medications, and respiratory hygiene and cough etiquette. Those standard precautions are not in our 2003 guidelines, but they are included in the summary, and they are new since the publication of the 2003 document. So we're going to go through the standard precautions in just a moment, but we have a poll right now, and I don't know where it is. I'm supposed to be getting live help, and I don't see him. Go to the poll tab. There we are, poll number 1. Okay, does your office have an infection control coordinator? Yes or no? And if you could all take a moment and answer this question, that would be great. And I'm going to give you about 15 to 20 seconds to talk about that and answer that. In a couple more seconds, I'll close the poll and then I'll show the tabulation so you can all see. The answers are still coming in, and you can see I have yes, no, and I'm just not sure. It looks like we're coming to a close there, so I'm going to close the poll, and I'm going to show the results to everybody. Okay, you can see that 56% say yes, 35% say no, and 8.5% say, hey, I'm not quite sure. So those who say yes, great. I'm glad you know you have an infection control coordinator. Those who say no, you need to have one, and if you're not sure, by default, it is your owner dentist. And I'm not sure, once again, it is the owner dentist. So let me return to my slides, and I'm going to move on to my next slide, because in the more new information in the summary, and I want to show some new administrative measures, and the third bullet point says assign at least one infection control coordinator. And the infection control coordinator has a big job. This is one person who is trained and responsible to coordinate the whole infection control program, and they have lots of responsibilities. They are not in charge of the whole program or compliance within the whole program, but they're supposed to coordinate, make sure that the documents are there, supplies are necessary, staff is trained, etc. So make sure when you go back to your practice next week that you know who your infection control coordinator is. And if you have any questions about this, I'll give you some resources toward the end on how to make this work and how to train that person who is your infection control coordinator. So some new administrative measures that the CDC says within the summary include having a written infection prevention policies and procedures. So it's not just that you have a program, it's that it must be written down. Number 2, the program must be assessed at least annually. 3, we have at least one infection control coordinator within each facility. We 4th, provide supplies necessary for standard precautions. The next bullet point, have a system to detect and manage potentially infectious persons at initial patient encounter. So if you had somebody enter the office and they're coughing, hacking, and sneezing, what do you do? How do you detect that? What systems are in place to manage that? And finally, maintaining training records. It's important to note that these bullet points are also included in the OSHA bloodborne pathogen standard. So once again, we have CDC guidelines that have been translated into OSHA regulations. So let's go over some more on the next slide. New information that's included in the summary. I mentioned that respiratory hygiene and cough etiquette is new in the summary, and here are some of the recommendations. Number 1, contain respiratory secretions of those who have signs and symptoms of respiratory infection, and that would be your patient or a friend of a patient who accompanies them into the office who is coughing, hacking, and sneezing. And what you would have on standby would be a sign on the door or somewhere in the reception area instructing these people to cover your cough and how, providing tissues, providing a hands-free receptacle to throw the tissues away, and having an alcohol hand sanitizer available, and providing masks to people who are symptomatic. Also, if you have somebody coming in like that who has these symptoms, you should encourage them to sit as far away from other people as possible to limit the spread of these illnesses. Now, does your office have provide parenteral medications? So I have to go to my poll number 2, conduct poll. So does your office provide IV sedation, yes or no? And this will lead me into my next slide, why I ask this. And parenteral medications would be any type of sedation procedure that's intravenously intravenously administered. And bear with me, I'm going to get a drink of water while you conduct your poll, and I'll be back with you in about 10 seconds. I'm going to show the poll in a few seconds, but it looks like most of the people on this webinar do not perform IV sedation in their facility. And it looks like we're pretty much coming to a close. So I'm going to close the poll, and show the results to you. You can see about 91% say no and about 9.1% say yes. And those who do perform IV sedation typically perform some type of surgical procedure, whether it be oral surgery, periosurgery, endosurgery, or something of the sort, or private practice offering that as a for their patients. So on to the next slide. So here's another new component within the CDC summary, safe injection practices. And this is, I'll keep it simple today. There are many components to it. For those of you who do perform IV sedation, I encourage you to look at the summary. But CDC has a new campaign. It is one needle, one syringe, only one time. And they encourage people to use aseptic technique in a clean area to prepare these injections. There are instructions how to disinfect the rubber septum, how to use single-use medications and never use them for more than one patient. If you have a multi-dose vial, you have to ideally keep it to one patient when possible. And if you do use multi-dose vials, keep them in a central medication area and discard after use and discard within 28 days or according to manufacturer's instructions. But the major point of this is never reinsert a used syringe with or without the same needle into a medication vial before using on a patient. So once again, I encourage you to look at your summary, and if you're providing this procedure to your patients, I encourage you to look at the CDC campaign and learn more about it. With regard to sterilization and disinfection of patient care items, there are a couple new recommendations. And first and foremost is have manufacturer's instructions for reprocessing readily available. And this is not really a new thing, but CDC is definitely stressing it. The manufacturer should supply information about the design of the device, instructions for use, how do you take it apart, clean it, reprocess it, sterilize it, disinfect it, what type of detergents or enzymes or cleaners or lubricants should be used, exposure time to chemicals, education for staff, and limitations about how many times the device can be used without it breaking down. So that the instructions for use should be ideally available where you reprocess instruments. Also, the sterilized items should be labeled with sterilizer used if you have more than one, the cycle or load number, the date of sterilization, and expiration date if there is one. And ensure routine maintenance for sterilization equipment according to the manufacturer's instructions, and maintain records. All throughout the infection control literature comes more and more emphasis on manufacturer's instructions, because manufacturers are becoming more involved and accountable with infection prevention. So don't ever hesitate to contact your manufacturer if something doesn't make sense on their instructions. So we talked about new information contained into the summary, but let's talk about some key recommendations. And I want to stress that what I'm about to say in the following slides is not new information. This is a review of what has already been written in the 2003 guidelines. So we'll start with education and training. Ongoing education and training are critical to make sure that all infection prevention policies and procedures are understood and followed. So we are to provide job-specific education and training, and that should include employees from outside agencies and volunteers who come in your office as well. Provide training on safety and patient safety, provide training during orientation and regular intervals, and maintain these training records according to state and federal regulations. Now, personnel safety. Provide a written policy for immunizations. We talked to immunizations I'll talk about them in the upcoming slide a little bit. Screen all personnel for tuberculosis, arrange referrals for preventative services and occupationally related services and post-exposure management, and have these policies in place for personnel who have potentially transmissible conditions. It's important to have referral arrangements made in advance before an occupational injury should occur. The worst thing that can happen is you have an occupational injury in the office, somebody has a needle stick injury from a contaminated instrument, and you look at each other and say, now what? Where do we go? I think you should go here. No, the best place to go is there, and not have this arranged in advance. Already right now you should be thinking, if you should have an injury at the office, where do you go? What do you do? What forms need to be filled out? What's the chain of events that should occur? This all should be arranged in advance, and it's part of personnel safety. So let's talk a little bit about immunizations. CDC recommends that these vaccinations be given to healthcare workers. You can see on the top of the list is hepatitis B, and I'm hoping that all of you who are listening today have had the hepatitis B vaccination. A flu vaccination is recommended annually. Measles, mumps, rubella, chickenpox, Tdap, which is tetanus, diphtheria, pertussis, and then meningococcal, if you are working with those in a laboratory that has that. Now let's talk a little bit about hepatitis B. OSHA requires that employers offer the hepatitis B vaccination to all employees who have potential contact with blood or other infectious material, and this should be offered within 10 days of employment at no cost to the employee. So that's really cool. This is the one and only vaccination that you might get for free from your employer. And as you already know, this is a 3-shot series, and then serological testing is recommended. And this came into being in the early 80s, and since that time, hepatitis B rates among healthcare workers has declined from 17,000 to 139 period cases annually, which is awesome. Now, there's one frequently asked question about the hepatitis B vaccination, and here it is. Are boosters recommended? The CDC says that hepatitis B boosters are not routinely recommended, that the immunological memory remains intact for about 25 years. Of course, we don't have a lifetime of studies on this yet because the vaccination has only been around since the early to mid 1980s, but it does confer protection against the hepatitis B vaccination. So people with declining hepatitis B titers are still protected against infection and chronic diseases, but it's best to discuss whether a booster or not is recommended with your healthcare provider. I have seen some healthcare providers say, I don't care about your declining titers and your immunological memory, let's give you a booster anyway. And I've seen some dental personnel say, yes, I'm about to go on a mission trip in an area that has a high incidence of hepatitis B, my titers have declined, and the healthcare provider says, let's give you a booster. So on a routine basis, the CDC does not recommend it. There are specific indications for it, and I encourage you all to talk to your healthcare provider if you are in question. So let's review hand hygiene, and hand hygiene itself could be an entire presentation, but the quick review in the summary includes wash your hands when hands are visibly soiled. They absolutely must be washed if you see visible contamination. After barehanded touching of instruments, equipment, materials, and other objects that are likely to be contaminated. Hands need to be cleaned before and after treating each patient, before donning and removing gloves. You can use soap and water when your hands are visible. Otherwise, an alcohol-based hand rub may be used. For those of you who are performing surgical procedures, perform surgical hand scrub prior to putting on sterile surgeon's gloves, and always follow the manufacturer's instructions for the product that you are using. And that might seem common sense, but not always. For instance, one product that I used was dispensed in a foam type of product, and the manufacturer's instructions say, for a general procedure, dental procedure, dispense the amount the size of a golf ball, but for a surgical procedure, dispense the amount the size of a tennis ball. Obviously, more product for a surgical procedure, your hand would be exposed to the agent for a longer period of time. So look at your manufacturer's instructions, because not all products have the same instructions. With regard to PPE, make sure that PPE is available and accessible. Educate personnel on proper selection and use of PPE. Wear gloves when you have potential for contact with body fluids, mucous membranes, or contaminated equipment. Remember that gloves are always single use. You might laugh, but I've seen some offices one office a couple years ago where the owner dentist encouraged their dental personnel to wash the gloves, turn them inside out, and use them on the next patient. You can't do that. Gloves are single use. This is not a way to save $1. PPE must be worn that covers skin and personal clothing whenever you anticipate contact with blood, saliva. Nose and eye protection should be worn during procedures that are likely to generate splashes, spraying, or aerosols, and PPE should be removed before leaving the work area. Moving on to sharp safety. And once again, this is not new information, but a quick review. Consider contaminated sharps, such as needles, scalers, burrs, etc., as potentially infective. Establish engineering controls and work practice controls to prevent injuries. Use a one-handed scoop technique to recap, or use a little device, a needle capping device. Never, ever recap a needle using both hands. Place used syringes and needles in a sharps container, and that should be puncture resistant and properly labeled. And this container should be located as close as possible to the area where items are used. And that would be in the treatment room or the operatory. Oftentimes I've seen these containers in central sterilization, and that means somebody is transporting these through the office, and that's an accident waiting to happen. So ideally, put your sharps container as close as possible to the area where it is used. With regard to sterilization and disinfection of patient care items, this is not new information, but a review of what we already know. Clean and reprocess appropriately before use on another patient. Follow manufacturer's instructions. And once again, we're following manufacturer's instructions, IFUs. Oh, we're seeing that over and over again. If these instructions are not provided, the device may not be considered a multiple patient use item. It might be considered a single use patient item. So read your instructions. Have these instructions available. Wear appropriate PPE. Train personnel on how to sterilize and reprocess instruments. Use mechanical, chemical, and biological indicators, once again according to the manufacturer's instructions, and maintain sterilization records according to state and local regulations. Check with your state dental department, and they should have or your state OSHA, and there should be guidelines and regulations on what records need to be maintained and for how long. Moving on to environmental infection prevention, the policies and procedures for routine cleaning and disinfection should be there and written. Surface barriers for difficult to clean areas should be available, and in my office we used them for X-ray, frequently touched areas on the X-ray, the bracket table, the computer monitor, the keyboard, and the mouse. And these barriers need to be changed between patients. Use an EPA registered hospital disinfectant, an intermediate level with TB claim if it's contaminated with blood. And once again, as we already talked about, follow the manufacturer's instructions. Once again, these environmental surface cleaners and disinfectants are not all the same. Some have a 1-minute kill time, some have a 5-minute kill time, some take 10 minutes to kill the required microorganisms. So the surface needs to be wet for that entire period of time. Some of the products are meant to clean, some are meant to disinfect, some are meant to do both. Also, some of the newer products are meant to clean and disinfect it in one fell swoop. So read your instructions and make sure you're using this product properly. And finally, dental water. It's important that we use water that meets EPA regulatory standards for drinking water. That would be 500 colony forming units per milliliter of water bacteria for routine treatment. Once again, read that first bullet point because you might see that on a quiz coming up. Follow the instructions for use, for methods and equipment to maintain the water quality, and use sterile water or sterile saline as a coolant or an irrigant if you are performing surgical procedures. That is a lot of information. So let's move on to these checklists. What are they? What are they for? How are they to be used? At the end of the CDC summary, there are 2 checklists. This first section assesses the policies and practices, including education and training of your office. And the second checklist involves direct observation of people in action. And it provides feedback to the personnel regarding performance. So some of the areas to be assessed in the second include hand hygiene. Let somebody watch you. Are you doing it right? Are your hands wet for the correct amount of time? Are you rubbing all areas of your hand and not missing areas? If you're using alcohol hand sanitizers, is the agent exposed to all surfaces of your hands for the correct amount of time? Then there's also PPE, sharp safety, respiratory hygiene, cough etiquette, safe injection practices, sterilization, disinfection, environmental surfaces, etc. So all of the tasks that are performed in these various areas can be assessed with a direct observation. Now, note that these checklists are not mandatory. Once again, this is CDC is an advisory agency, so these are not mandated. But if you work in some systems like military or hospital settings, sometimes they do have checklists that do need to be followed and put on file. But for routine dental practices, if you're following the CDC guidelines and these checklists, it's not mandated. It's an optional thing. But these checklists can serve as an evaluation tool to monitor compliance and provide an assurance of quality control to make sure you're doing things right. Now, I want to show you something really cool. The CDC came out with a new app. It's called CDC Dental Check. And this is the Infection Prevention and Control Checklist application that is available on the iTunes Store for free. And it's very cool because it not only has the checklists that I just described, but it has links to the CDC guidelines, links to the summary, links to the actual recommendations themselves. So it's very cool, and it allows you to keep this information on file either electronically or printed out, and provide feedback to your dental personnel regarding performance. And positive responses help assure that you are indeed meeting the minimum expectations for delivery of safe care, and negative responses, however, highlight areas that you need a little bit more education, training, and attention to detail, and a correction of the practice. So this is really cool, and it is for your information. Okay, moving on. Okay. The application was developed for infection prevention, and some features of this: check yes or no to acknowledge compliance. It includes the summary of basic infection prevention recommendations, and like I said, provides links to the full guidelines and the source documents. Now, there are references in the CDC summary as well within the Appendix D, and these references include relevant recommendations published by CDC since 2003. We went over some of them, and additional resources by topic area. So it's great to have standby as a reference and a resource as well. So some final comments about the CDC summary. It's not meant as a substitute for the 2003 guidelines. It is an abridged vote. An abridged version. It's meant to be a study aid and facilitate rapid learning of key points. The key learning points are highlighted and you can pick them out easily. And it gives you a fresh point of view and it encourages you to take an active role in your education. And this summary can be an introduction, a refresher, or a quick and handy reference on whatever specific topic you might want to delve into. So it's a great document, and I encourage you to obtain one and keep it on file. You can download it for free on the CDC website, or you can write to the CDC and have them send you a printed version. Now, do you have any more resources for us? Yes, OSAP. OSAP is the Organization for Safety, Asepsis, and Prevention. And it has a mission to be the world's leading provider of education that supports a safe dental visit. And OSAP is a community of clinicians, educators, researchers, industry representatives who advocate safe and infection-free delivery of oral health care. There, on the OSAP website, there's an extensive collection of resources, publications, frequently asked questions, checklists, toolkits, anything to help dental professionals deliver the safest dental visit possible. And plus, there are 2 live courses, Boot Camp and the annual conference. Boot Camp, I'll tell you about those in just a second. I want to note also that September, this month, is Dental Infection Control Awareness Month. And this is a month-long campaign to focus a positive light on infection control in dentistry, and it's to demonstrate your commitment to infection control, increase your staff knowledge, engage your patients, build your practice with outreach, leverage social media, and on the OSAP website there are downloadable posters, resources, talking points, tools, etc. for you. And it's a way to start the conversation with your patients. So OSAP has 2 conferences per year. The OSAP Infection Control Boot Camp is in January. This year it's in Baltimore, Maryland. And the annual conference is in Dallas, Texas next May through June 2018. The Infection Control Boot Camp gives you a foundation in the basics of infection control, whereas the annual conference would be for those who are educators, consultants, and providing that type of education and training to folks. So the boot camp is more basic, the conference is a little bit more advanced. And you can check the OSAP website to learn the difference to see if one or the other would be best for you. Or you could just email me and I could tell you. So let's talk about questions and see if we have any questions from our audience. And I've got 14 questions, and let me see if I can find them. The first question is the hepatitis B vaccination required to be offered to the front desk employees who do not have clinical duties? No, it is not. However, if you have a front desk personnel and periodically you say to them, hey, can you step in the back and help me process these instruments? Hey, can you step in this operatory and help me wipe down these environmental surfaces? Then yes. If your responsibilities are exclusively front desk and you never ever cross that line into the clinical area, then no. But if periodically you need to be performing clinical duties, then yes. Is this webinar eligible to renew the mandatory continuing ed for dental license? Continuing ed requirements vary from state to state. You need to check with your state to see what's mandated with regard to infection control. But as far as federal OSHA is concerned, 1 hour of CDE is mandated, and yes, it would satisfy that requirement. Where can I get that sign? I assume you mean the downloadable poster, and you can get that from the OSAP website. Next slide. Is using an alcohol hand sanitizer as effective as hand washing? Studies have shown that yes, it is as effective, more effective at killing the germs on your hands. It denatures the proteins in the microorganisms on your hands. However, if your hands are visibly soiled, they absolutely must be washed. Alcohol hand sanitizers will not remove debris on your hands. They will just denature the proteins and kill the germs on your hands. Somebody said they were not able to vote. Unfortunately, I can't help you out there because I'm not on technical support. Okay, somebody said I misspelled a word. Sorry about that. And I have a couple more questions for you. And question is, what is the summary of infection prevention practices in dental health settings, basic expectations for care? The answer is that this does reflect existing evidence-based guidelines produced by the CDC, and it's written in plain language, and you might see that question coming up on a quiz somewhere. What are standard precautions? They're a set of practices used when treating all patients, regardless of whether the patient has a known infection. Now, CDC recommends that one person in the staff is assigned to be what? And that would be the infection control coordinator. And that person coordinates the entire infection control program in the office. And a question regarding safe injection practices, what are they? Safe injection practices are using aseptic technique to prepare injections, disinfecting the rubber septum on a medication vial, keeping multi-dose vials in a centralized medication area. So keep that in mind as well. That might be on a quiz somewhere. And how can the checklists in this summary be used? They can serve as an evaluation tool to monitor compliance and provide an assurance of quality control. Now, let me see if I've got any more questions. Is the CDC app only available for Apple users, or can they be used on an Android device, PCs as well? I'm going to back up my slide to answer that one because there we are. I believe it can, but unfortunately, don't quote me on that. You'll have to check. You can go to the iTunes store, find it, and see if it's available for your device. I'm sorry, I don't have any more information for you other than that. Here is a question regarding a cold sterilization solution, and what I want to share with you is that cold sterile solutions are on the decline for several reasons. Number one, it's difficult to monitor. Number two, the instructions for use have to be followed. It's difficult to follow the instructions for use. I've seen cold sterilization solutions in practice that I once worked at, and you don't know if some objects that had been placed in there were retrieved after 5 minutes, 5 hours, or 5 days. They really didn't monitor how long was in there and for what duration. The second thing is that that instruments should not be stored unwrapped or unpackaged, and when they emerge from cold sterilization solutions, they are unwrapped. So ideally, they should be taken to the point of use and used immediately. Let's see. Is it better to use sprays or wipes? Well, the jury is still out on that. Some people have a preference for one or the other, but in general, sprays can give you a little bit more respiratory problems. You must remember, if you use a spray, this is not an air freshener. It's meant for your surfaces. Spray it on your surfaces, wait for the duration of time that it's required to be wet, and then wipe it down. Due to the misuse, there's often a lot more respiratory symptoms that happen with sprays, coughing, hacking, and sneezing, but if used properly, they will be just fine. Having said all of that, wipes are definitely on the incline and spray use is on the decline for that reason. The question from Susan says, is it necessary to use a barrier on non-porous, easy to clean surfaces such as light handles? I recommend, Susan, that you put your heads together with your dental team members and decide which surfaces that you want to barrier protect and why, and that you make it standard throughout your office and you have a facility-specific policy on what surfaces are barrier protected. In my office, I don't practice dentistry anymore, but when I did, the surfaces that we barrier protected were surfaces that were frequently touched, and our light handles were not one of them. If light handles are frequently touched in your practice, for instance, you turn the lights down when you are using your curing light so you don't have light contamination, then so be it. That can be on your office policy. Like I mentioned, I used barriers on surfaces that are difficult to clean and surfaces that might be a little bit more porous. So I'm going to let you look into that with your dental team, set your policy, and make it a facility-wide policy. Here's a good question for you, Dr. J. Is there any authority that gives some kind of accreditation or certification for infection control for countries other than the USA? He practices in India. Dr. J, currently there is no certification specific to dental infection prevention at all. However, having said that, OSAP is currently working with the Dale and Danby Foundation to develop a certification course, and that's in the process of being developed right now as we speak. I do not have an update that gives us a date of release or when we might anticipate that, so stay tuned on that. I'm not aware of any other type of, any other country that offers accreditation or certification for infection prevention in dentistry. In medicine, yes, there are plenty. In dentistry, not yet, but stay tuned. Here's a question from Bianca. What do you do when assistant coughs or sneezes and is told to wear a mask but does not listen? When asked when taught in school, she said yes, but ignores. Bianca, I recommend that you get your whole team together and you address infection control in something called a culture of safety. And I recommend you look up culture of safety and what that means. And what it means is that you all get together and all team members feel free to speak up when an infection control breach occurs or something seems out of the norm. In that situation, your team members should feel free to speak to this assistant and say, we need you to wear your mask, or we need you to do such and such, wear such and such PPE, whatever it might be, that you feel free to bring it up. So it's not threatening, you're not finger pointing, you're not bullying per se, but this is a culture of safety where everybody feels free to speak up with regard to any aspect of infection control. And you have to set that mode or milieu before it occurs. So I encourage you to have a dialogue, keep the conversation going. Okay. Let's see what else. Karen, my dear friend, I've seen two friends on this webinar. Thank you, Karen. for attending. And I should mention that this does not fulfill OSHA bloodborne pathogen annual training, so don't get confused by this. Lisa is a compliance officer for a dental board in Massachusetts, and she does believe that this course would be accepted for the infection control requirement in Massachusetts. So once again, check with your specific state. Here's a good question from Christine. Are slow speed handpieces, hygiene handpieces, required to be sterilized or just recommended to be sterilized? They're required to be sterilized now, Christine. And if you look in the summary, you're going to see that handpiece sterilization is stressed, and that has put a lot of folks in a tizzy in the last couple of years with regard to sterilization of handpieces, hygiene, slow speeds, etc. So read your summary, and there's an exact, I don't know if I can find the exact page that quickly, but it is written in there. I encourage you to look at the summary. And let's see, one more comment. Thank you, you did great. Thank you for the great info. Thank you for listening, appreciate it. Here's a question on spore testing, and I'm going to have this be our final question because it is 8 o'clock Eastern Standard Time, and I do have to wrap this up. How often do you do spore testing? Spore testing, according to the CDC, should be done weekly in the United States. If you are in Canada or another country, your laws might be different. Some provinces in Canada require daily. In the US, it is weekly, and if you are sterilizing implantable devices with each load. So I need to know a little bit more information where you're practicing and what you're doing with that. But the general recommendations are at least weekly with the CDC. Oh, thank you, Joyce Moore, another dear friend of mine. She said that the Check app is not available for Android devices at this time. Thank you, Joyce, for checking into that for me. Karen Daw, my other dear friend, says the CDC checklist is currently available only for Apple users. So sorry, but you can use it on your iPad or iPhone as well. So with that, I am going to close our webinar. I encourage you to all go to your 5-question assessment. And once again, I attempted to make this very easy for you, and I want to thank you all for attending this webinar with me this evening. Thank you again to Air Techniques for sponsoring this event. Much appreciated. I wish you all a good evening, and to those of you who have friends or loved ones in hurricane-affected areas, my thoughts and prayers are with you. With that, have a good evening until we meet again.